Good morning everyone. Today we will be talking on Suryabhedana Pranayama. Surya means sun and Vedana means the opening of sun. Yoga believes the right nostril as Surya Nadi and the left one called as Chandra Nadi. So the Vedana means opening of right nostrils, means the activation of right nostrils through this particular pranayama or particular kumbhaka practice, pranayama practice, that is Suryabhedana Pranayama. Vedana means the right nostril should be open by prana, by air. So let's see what the practicing procedure explains under Hatha Yoga Pradipika or Hatha Pradipika you say. The line goes here, Asane Sukhede Yogi Vadva Chaiva Ashanam Tataha Dakshanadya Sama Akrishya Bahistham Pavanam Shanaihi. Please focus here. They explain here Ashane in the state of Asana. Asanam Sabda is in Saptami Ekavachanam explains here, mean in the state of asana. It means any kind of asana. It may be Swastikasana, maybe Vajrasana, or it may be Padmasana, or any kind of Shukhasana where the practitioner is comfortable about him or her. Ashane. Shukhade means in the state of happiness. After adopting the asana, he should not be feel odd, he should not feel difficulty. Means the continuous practice asana must be there and the person should be achieve the state of sukhanesh, happiness, easiness. So any asana it may be. Yogi, the practitioner, badva chaiva asanam tatha. After adopting that particular chaiva asana, means that particular asana, which asana he is comfortable about that. Tataha, later on what he should do? Dakshana nadya. Daksha means the right nostril. Nadya means nadi, means through the right nostril. What you have to do? Sama akrishya. Akrishya means inhalations or dragging. Sama means exactly, fulfilly. So particularly the person should drag the air, should inhale the air. Which air? Bahistam, not antastam, bahistam. The air which is present in the atmosphere. That pavanam, that air should be taken care of. Shanahi means slowly. So what is explained here? The person should inhale the air through right nostril. Inhalation through right nostril. Okay, and it should not be done forcefully. It should be done very slowly, gradually. Till now we understood this. Okay. Now up to here you should do Akeshat Nakha Agracha Niradha Abodhi Kumbhayet Tataha Shanaihi Shabya Nadya Rechayet Pavanam Shanaihi. Akeshat. Akeshat means up to Kesha. Kesha means hairs. The feeling of sensation of or the kumbhaka duration should be you should feel the sensation where? In the keshas, in the rome, means in the rome or in the hair you should feel the sensation. In the heat should be felt out. Akesha means akantham, like we call the akantha paryantam, means till the kantha, till the throat. Here akesha means up to kesha. The sensation should be felt the last part of your body, means the rome. Not only in the muscles level, not only bone level, not only outer superficial level, skin level, it should be in the Roma level. So akeshat. Then nakha agracha, tip of your nails, means until you feel the difficulty, tip of these nails or the kesha, you need to do the nirodha. Nirodha means holding. Abadhi means the time duration of until you feel the sensation on your tip of your nails as well as in the kesha level. You have to do the kumbhaka. Kumbhaka means the retention. So retention should be done till that position. It may be for a person 1 second, for a person 10, for a person 1 minute, 2 minutes, depend on the yatha shakti, up to one's capacity. Kumbhaye. Then what you have to do? Tataha. Then shanaihi means slowly, gradually. Sabya nadya. Sabya means the left one. Daksha means the right one and Sabya means the left one. Sabya nadya rechayat pavanam shanaihi. Shanaihi means slowly. After doing kumbhaka, up to your capacity. Capacity must be the person should feel the sensation tip of your nails and the tip of the hairs. Then you have to exhale that air, inhale air after doing Kumbhaka through the left nostril. So Nadya means through the left nostril, that is Ida Nadi or Chandra Nadi. Sabya means left. Rechana means exhalation. Exhalation of what? Pavanam. So what he is explaining? The inhalation should be taken care of through the right nostrils, and it has to be Kumbhakam, and it should be written up to one's capacity. And that capacity must be depend on person to person. The person should feel the sensation tip of his hairs, means roma, as well as tip of the nails. Then he should exhale that air through the left nostril. So these two sloka explain about the practicing procedure. Now let's look at the benefits of Suryabhedana Pranayama. These two are related to the practicing procedure, and let's see the benefits. What the benefit explained as per Hatha Pradipika or Hatha Yoga Pradipika, that is Kapalo Shodhanam, Bata Doshagnam, Krimidasha Hrit, Punha Idam Karyam, Suryabhedanam Uttamam. What the first benefit explain about the Kapala Shodhanam. Kapala means the skull area. The skull area what we have, that will be Shodhanam, means Suddhi. The cleansing of our cranial part, means the frontal part. We have the different kind of sinuses, frontal sinuses, ethmoid sinuses, sphenoid and all. So the frontal part, that will be cleansed. Means our thinking capacity, eligibility capacity, that will be enhanced. So Kapala Shodhanam. Vata dosha ghram. Vata dosha means the dosha predominant by Vata. The disease which is aggravated by Vata problem, means Vayu related problems, maybe joint pains or maybe some other kind of irregular of Pavana Vayu problem, any kind of where the Vata dosha is more, the empty space. That will be ghram, means destroying, elimination of Vata dosha. Many kind of Vata doshas are there. We will be talking in upcoming times. There are 80 types of Vata doshas are there, and Pitta related there are 40 types, and Kapha related 20 types. So those 80 kind of diseases, maybe small kind of diseases, micro disorders, that can be destroyed by practice of Suryabhedana. Then Krimi dosha hrit. Hrit means haranam, destroy, or the elimination of krimi. Krimi nothing but they are krimayaha, the worms, or you can they are called as the parasites which is present inside the body, means internal krimis, and some other called external, antar and vahi. External are like present on your skin, you got some wound and some fungus comes or some microbes comes, they form some kind of doshas. Or on your hairs, on your sweat, they call as the external, vaiha krimi. And internals are in your intestine, stomach, or it may be your gut microbiota. So what I'm talking here is the krimi. Krimi may be good or bad. If it is bad for your health, those can be destroyed. Nowadays there is a good concept called as the microbes, prebiotics, postbiotics and biotics. Okay, so those related concept, if a person practice Suryabhedana Pranayama, that can be overcome by producing the heat, generating heat. Okay, I am giving just only this slide regarding the textual explanation, textual. The next slide will be talking the scientific approach to that. Okay, and how it is interconnected. So Krimi dosha, krimi means intestinal worms will be there, or it may be any kind of fungi, or it may be any kind of parasites or microbes. Those can be destroyed. So three benefits. Kapala Shodhanam, the skull area, cranial area will be clean, which will happen with the practicing of the Kapalabhati also. Then Vata dosha, the problem regarding the Vatas. There are 80 types of problem that can be targeted. And Krimi dosha, due to the cold effect of body, krimi they produced and krimi form. And due to the practicing of the Suryabhedana, the heat generating pranayama, that krimi dosha can be overcome. We'll be talking how it's possible. So punha idam karyam. Karyam means this only the actions. What is our action is practicing Suryabhedanam. Suryabhedana uttama. This is the uttama practice, great practice. Okay. So next slide will be talking the scientific approach to this. Scientific approach. Let us understand the actions of Suryabhedana Pranayama in terms of two dimensions. One is autonomic nervous system, another is cardiovascular system. Before starting, let us understand what is autonomic nervous system. The autonomic nervous system nothing but is a part of peripheral nervous system, PNS, which is opposite to CNS. Means the system which is coming out from the central part. Okay, hands, legs and so on. And autonomic nervous system is the part of peripheral nervous system. Again, autonomic nervous system is bifurcated in two ways. One is sympathetic nervous system, another is parasympathetic nervous system. Sympathetic nervous system is responsible for all kind of fight and flight movement, means the activation form. The any kind of active form means working, thinking, doing hard work, running, playing football, so and so. All comes under sympathetic actions. Another one called as the parasympathetic, which is called as the rest and digest. When you take rest, when you think, when you sleep, when you go for pranayama, when you go for some meditation, that called as the parasympathetic domain. When you sleep, our body gets repaired under parasympathetic domain. So these are the two dimensions under autonomic nervous system. Now how this autonomic nervous system works under Suryabhedana Pranayama, let's understand that first. See, when a person inhale fully by Suryabhedana Pranayama, the prana goes to the nasal cavity, means in the right nostril. The Suryabhedana should be taken through right nostril. So right nostril is there, and the right nostril is connected to the left hemisphere, our left side. We have the two hemisphere, left and right. So the right ear means right vayu, means Dakshinadya vayu, the Suryabhedana Pranayama, the air will stimulate to the left part of our brain. Okay, left hemisphere. See, through the nasal cavity, means the air will pass through the nose, called as the nasal or nasal mucosa. Respiratory mucosa will be there, and they are connected to this respiratory mucosa will be there. In here, there is a receptors are present. There are two types of receptors under this. That called as the mechanical receptors. Okay, my handwriting is so good. Please understand. Mechanical receptors, as well one is called the thermoreceptors. Thermoreceptors. Other two receptors also there. Okay, there are four types of receptors through our body. One is mechanical, and one is called thermoreceptors. Other two called as the photoreceptor as well as chemoreceptors. The mechanical receptors are responsible for all kind of mechanical actions. It means stretching, vibrations and so on. Thermoreceptors are mainly responsible for all kind of heat and cold, temperature management. And the photoreceptor responsible for the detecting the light. Okay, light. And the chemoreceptor responsible for the chemical balance in the blood, maybe oxygen and CO2. Our discussion is regarding this. We are now discussing like this. Okay, because we are talking about the autonomic system. So that purpose we are talking here. So when the air is passing, the heat air means through the right nostrils, the air is passing through the right nostril means it will stimulate two receptors. One is called mechanical receptors in the nasal mucosa as well as thermoreceptors. Thermoreceptors. If the air is cold outside, still you are inhaling through the right nostrils. It will change the cold to heat. What will change? The thermoreceptors, which is present in the respiratory mucosa. So you may ask, when Suryabhedana, if the atmosphere is cold, if I are practicing in the winter time, is it okay or not? Yes, it may be good, depending on your capacity. If your body already heated, means by birth your quality is to produce more heat, pitta quality, then it is okay. Your receptors, means thermoreceptor, automatically it can regulate cold to heat. If it is not able to do, then not good for you. Mechanical receptors, it will feel the stretching or vibrations which is present in the respiratory mucosa. And these two receptors are connected to the termigenial nerve, which is the fifth cranial nerve. The fifth cranial nerve in the central nervous system, means cranial nerve. So this is called fifth cranial nerve, called trigeminal nerve, and it is connected to the hypothalamus. This is the hypothalamus presented. Okay, and hypothalamus also connected to the brainstem, pons, medulla, and so on. The message will go through the next way. What I am said till now, the prana or the air through Suryabhedana, whatever you have inhaled through the right nostrils, that will go through the respiratory mucosa. And there are two one is called mechanical receptor as well as thermoreceptors. Thermo means it will maintain the temperature. If it is cold, it will take as heat by regulating that. If it is heat, it will take to normal. And mechanical means response for the stretching, vibrations, and also. And these two receptors will stimulate the trigeminal nerve, the fifth cranial nerve. And fifth cranial nerve is connected to the hypothalamus. And hypothalamus will send the signal to the brainstem, lower part of your vertebra. And the brain will activate and it will go, the message will go. Now, by that what will happen? The sympathetic tone will be activated. Sympathetic tone means, as we discussed, the autonomic nervous system are two types. One is sympathetic, another is parasympathetic. So, sympathetic nervous system is connected to the fight and flight action. So, your all activation will be hyper, all kind of activation, and it will work on the heart. If it is working on the heart SA node having the beta 1 adrenergic receptors, and that will be activated, overstimulated actually. SA node overstimulated, and it is overstimulated, that increase stimulation will do the contraction on the myocardial contractility to induce the myocardial contractility, the layers of the cover of the heart, myocardium, that will be over stimulated. Depolarization will take place more, and if it is getting more means the heart rate will be going up. Normal heart rate is 60 to 100 times, that will go more than 100 times. Why it is happening? Due to the activation, overstimulation of the sympathetic tone. How it is got activated? Through the hypothalamus, which is coming through the brainstem. And hypothalamus, how it is interconnected? It is got stimulation from the trigeminal nerve, the fifth cranial nerve. And how it is connected? It is connected to the mechanical as well as thermoreceptors, and that is connected to the inspiration from the right nostril, that is Suryabhedana. And his heart rate is got hike, that will increase the stroke volume. Okay, stroke volume will increase the cardiac output, and at the end the blood pressure will go up. Let's understand this pattern by pen and paper. Let us understand little deeply this concept what we have explained. So this is our heart. Just understand, this is our heart. It's not exactly the hypothetical heart what you have drawn over this. Okay. And this is the myocardial muscles. Let us understand that this is the SA node. SA node we have, and SA node contain which one? Beta 1 adrenergic receptors. Okay, beta 1 adrenergic receptors. AV node, this is AV node. AV node also having beta 1 adrenergic receptors, and this is the Purkinje system, Purkinje fibers. Okay, if the stimulation generated, that first the sympathetic activation will come through the brain, meaning the pons or medulla and the brainstem. There will be vasomotor area which will regulate the intention of whether it should be activated or it should be deactivated, whether it should be sympathetic domain should be sent out or parasympathetic domain should be sent out. So from the vasomotor area through the nerve, there will be message will come to the SA node, where there is a B1 adrenergic receptor, means beta 1 adrenergic receptor is present here. If this sympathetic outflow goes and stimulate on SA node on beta 1 adrenergic receptors, so SA node will be overstimulated. Again, how this overstimulation taking place? Due to the overactivation of sympathetic tone. That sympathetic tone will be thrown to the heart on the SA node. On SA node there is a beta 1 adrenergic receptors is present, and if the beta 1 adrenergic receptor is overstimulated, the SA node will try to contract more, it will stimulate more. If this stimulation moves like this way, first it will go towards the right side, then it will go towards the AV node, then AV node to the next to the ventricle side, the Purkinje system, and the myocardial cells, the myocardium will be depolarize. Depolarize means it will be stimulated. So what I am talking here, after the activation of the adrenergic stimulations, the contractility of the myocardium will be enhanced. Before it was maybe taking a little more time. Now it is overstimulated. Why? Due to the sympathetic activations. If it is done, then heart rate might be, it was normal. Normal it was maybe 72, it was there in a normal case. Now when it is increased, it will may become 120, may become. The normal range of heart rate is 60 to 100, normal. When it is overstimulated, it goes up to 120. If the heart rate goes up, many things will start. The contractility go up, and the stroke volume. The stroke means the contraction in one stroke. When the heart is contracts, when it goes for systole, that pressure will be more. If the pressure is more, means the ventricle filling will be very fast, and the output means the output of the blood, which is blood is present on the ventricle, that output will be high. So cardiac output will go up. Now how cardiac output is going up? Due to the overstimulation of the heart rate. Heart rate was normally 60 to 100 in normal state, resting state. Now due to the excess stimulation from SA node by beta 1 adrenergic receptors, the stimulations. And how does this stimulation come? From the vasomotor area, from this our brain, central nerve part, central or the medulla part. Due to the overstimulation of the from medulla, that stimulate the beta 1 adrenergic receptors, and the receptors overstimulating SA node, and SA node also do the same work on AV node, and AV node is sending this message very frequently to the myocardial cells, and myocardial cells are getting overactivated, and their contractility, depolarizations is going up. If the heart is contracting very fastly, what will happen? Heart rate will go up. As we discussed, heart rate will go up. Normal heart rate we already discussed 72 times. It may go 110, 120, 130 also. Okay. If the heart rate goes up, the blood which is pumping, if it is that timing gets decreased, so that it will do the fast fully. So the blood which is present, that will go more. So output will be more. Cardiac output almost 500 5000 ml blood. Okay, normal 5000 ml. But in case of this, that will be more, maybe 5200, 5300 ml, means 6 liter, almost more than 5 liters it will be. So cardiac output will go up. If the cardiac output goes up, automatically blood pressure will go up. See, I am not talking here whether the blood pressure, high blood pressure, means the HTN person, hypertension people can practice or not this yoga. That we will talk in some other time, in upcoming series and upcoming videos. Now I am talking here how this pranayama, means Suryabhedana Pranayama, physiologically affects on these parameters. This parameter means on the heart rate, on the stroke volume, on the output, and on the blood pressure. It may be good, it may not be good. We will be looking at. So please understand here what we talk here, how this pranayama works on autonomic nervous system as well as cardiovascular system. Cardio means heart, vascular means through the vessels. Any kind of physiological changes happen in the heart or in the heart cardiac muscles or in the vessels called as that related cardiovascular physiology. So here in case of this pranayama, it is again let me recap this whole things. By inhaling through the right nostril from here, what you are doing, we are activating the nasal mucosa. There are two types of receptors present, that is mechanoreceptors as well as thermoreceptor. They will be stimulated. If they are stimulated, they are going to stimulate the trigeminal nerve, that is fifth cranial nerve. If that is got sensitized or stimulated, that message will be sent to the hypothalamus, the master gland, not master, the master piece of the brain. And if this message goes there, then through the brainstem, it will go through the peripheral part. From the brainstem, there will be in the medulla part, obviously, there is a called vasomotor area. Through that vasomotor area, the sympathetic outflow will take place here. If sympathetic outflow takes place, means they will stimulate the beta 1, means beta 1 adrenergic receptors present on the SA node. So SA node will be overstimulated. Remember, heart is a myogenic organ. It will not need any other stimulation. It will do automatically. But if any external means through this sympathetic tone comes and it overstimulation comes, so that SA node will be overstimulated and that message into the AV node as well as the down path. If this thing happens, the myocardial cells will be overstimulated and it will be depolarized, excess depolarized, means contraction will take more. If there is a contraction more, the heart rate will go up rather than normal. It will go 120, 130 also. Heart rate will go up means the stroke volume, yes, the stroke volume will go up. Okay, heart rate, stroke volume go up means that automatically it will increase the cardiac output. If cardiac output goes up, then blood pressure is going up. Okay, so for your understanding purpose, what I am telling here, if the person having already high BP, then he may not go for this kind of practice. I will talk it later, who can practice, who cannot practice. Just understand the parameters I am talking here. So by that, what will happen? All this kind of the neuromechanical changes will make this pranayama heat generating pranayama, which will produces heat in the body. I am not talking the literal, the only superficial level of heat. No, the biochemical heat. When these things takes place, mean heart rate goes up, contractility of the myocardium goes up, some kind of biochemical heat will be generated. So automatically it will add to the blood volume, and blood volume heat means the body will automatically heat. It won't take place in one day, it takes time to be happen. So that's why we say Suryabhedana is heat generating pranayama. How does it making the heat? The thing is by the mechanical changes or the mechanical episodes. What are the mechanical episodes? Is we observe. Then here the increase of the myocardial activity will be increased, contraction will go up, muscle will contract, so sodium potassium exchange will take place. Okay, depolarizations of the muscles, repolarization of the muscle will take place, heart rate will go up, stroke volume will go up, as well as cardiac output, and at the end blood pressure will go up. So in this segment, what we discuss, how does Suryabhedana Pranayama works on the autonomic nervous system as well as cardiovascular system. Okay, if you like our video, please like and share and subscribe.